October is Breast Cancer Awareness Month, and while the message that breast cancer is real and can be prevented is finally filtering through, a lot of women and men don't really know the ins and outs of how to do a self-breast examination, when and what the risk factors are. We therefore spoke to Nurse Nali Kutsia from the Cancer Association of Namibia to find out exactly what, when and how.
I'm Sister Nali Kutsia. I'm the sister at the Cancer Association. So I'm mostly working with cancer patients. Part of my job is to do pap smears and breast examinations. I'm also doing hospital visits, patients who got mastectomies in the hospital. And I also do home visits. I work with patients with stomas. So yeah, and I also do a bit of counseling for patients who were diagnosed with cancer, so that I can know what is waiting for them, what must I do, where must I go. With the self-breast examination, you are the first one who can pick up the lump in your breast. So very important, if you do that, you will pick it up when it's still very small, and that will just make your chances much better for survival if you are diagnosed with breast cancer. Self-breast examination, you do it once a month. The best time to do a self-breast examination is usually 7 to 10 days after your last menstruation day. Ladies who are not menstruating, who are under injection, they will feel that their breasts are also getting tender during the month, and then they just wait until the breasts are normal again, and then they do their breast examination. Mothers who are breastfeeding, they do their breast examination when the baby has finished drinking, when the breasts are empty. Otherwise, the breasts are too full of milk to feel if there is anything wrong. Ladies who are in their menopause, they can pick and choose a date. They can do it the beginning of the month, the end of the month, anytime during the month, because they don't have the problem of breasts that are involved with hormone working in the body. So, yeah, once a month, very important. Ladies over 40 years must then go for the mammogram. So, but breast examination, very important that you do that. Okay, there is certain warning signs when you do the breast examination. First, when you do your breast examination, you must inspect your breast. So you stand in front of the mirror, you look at yourself, you lift up your arms over your head, and you see what your breast, if your breast moved or not moved, both, if they're the same, if there's the same height, things like that. Then you start with your fingers. You put your left hand behind your head. You use your middle 3 fingers, flat fingers, and you start on the side of the breast, circle movements around the breast. You feel for a lump in the breast. It can be small, it can be a little bit bigger. Not to say that all lumps are cancer lumps, but if you find a lump in your breast, it's important that you must work with that and go to your doctor or to your clinic so that they can have a look and send you for further tests for the lump. When you also look at your breast, there is certain warning signs for breast cancer. Your breast can differ in sizes. That is normal. But when one breast suddenly enlarges, then you must make work of it and go to your doctor so that I can have a look at that. When your nipple starts going inside, a nipple retraction, but some ladies do have a nipple that are retracted. They mustn't worry because that was usually the case. That is normal. But when you had nipples that were outwards and they suddenly go inwards, then you must start worrying. If the skin on your nipple area started to change, it gets a little bit rough, it gets irritated, red, it can be itching, it can be a problem. If the skin of your breast starts to change, we call it the orange peel skin. It makes little dimples in the skin. Then it's also a problem. They must look at that. Any lump in your breast that you can see, especially also under the top area of your breast, because this area has got a lot of lymph nodes in. So if there's a change in your breast, it will affect the lymph nodes. So there may be some swelling in the lymph nodes. Also under your armpit, if there is lymph nodes that are swelled, then there can be a problem of the breast. So this is the things that they must look at. Any discharge from the nipple. There we look at a bloody or a brownish discharge. We don't talk about a whitish or a watery discharge. That is normal because of hormone working in the body. And some ladies do tend to press their nipples a lot. they mustn't do that. They must just press it lightly to see if there is any discharge. But if you find a discharge, you need to go to your clinic or to your doctor. It can be maybe only an infection in the breast, but it can also be cancer that are affecting the breast. Yeah, so important that they must look out for warning signs. Men can also get breast cancer. They must also look at their breast. They've got the same signs and symptoms than the ladies. And they can also just feel the breast tissue, especially men who has got a lot of breast tissue. There we look at men who are a little bit overweight, where the breast tissue are more prominent. Also, men who has got a family history of breast cancer in their family, they must be more aware of that. So it's important that men also know that they can do a breast examination themselves, and if they find the lump in the breast, they must go to the doctor. Sometimes the men think it's just a lump, and they tend to ignore it, and when it starts spreading in the body, then they go to the doctor, and most of the time it's too late then. If we look at the risk factors for breast cancer, because there's no cause of breast cancer, but we do get risk factors. Then there's risk factors that you can do something about and some that you can't do anything about. The risk factors that you can't do anything about is your age. Breast cancer are more prevalent in the older ladies, but any lady, young ladies can also get breast cancer, so they must also be aware. Young ladies as 21, 24, they are also at risk to get breast cancer. But as I said, more the older ladies, older than 40. Then if you have got a family history of breast cancer, ladies whose grandmother or mother or one of their sisters had breast cancer, they have got a higher risk to also develop breast cancer. But if we look at the statistics, only 10% of breast cancer are hereditary. So it's not to say that you will get breast cancer if it's in your family. If you have had breast cancer already in one of your breasts, your risk is high to get it in the other breast. Then also hormone replacement therapy. Ladies who are in their menopause and who are using hormone replacement therapy, they are at risk if they are using it for very long times. So we advise the ladies usually that they can use hormone replacement, but they must only use it for a short time, just to curb the big problems like the hot flushes and the mood swings and things like that. Then ladies who didn't have any children, or ladies who had children after the age of 35 are at risk. Ladies who start very early when with their menstruation, that is the age 9, 10, 11 years. Ladies who go very late into their menopause after the age of 50. This is the things that you can't do anything about. That is part of your hormones and things. The things that you can do something about is your lifestyle. There we look at diet, we look at overweight ladies, ladies who are smoking, ladies who are misusing alcohol, who don't do any exercise. That is the ladies who are also at risk to get breast cancer. So very important that we know the risk factors. If we can do something about it, that we do something about it, start exercising. You don't have to go to a gym, just normal walk around the block every day. And then also look at your diet, low-fat diet, very important that we remove the fat, reduce our sugar intake so that we can reduce the fat in our body, because the fat are the stores of estrogen. Estrogen is the female hormone who feeds breast cancer. So that is important that is the reason why overweight is a problem for breast cancer. So if you know the risk factors, you can be more aware of your risk to get breast cancer.